Chapter 7, The Principles of Pathophysiology. Before we get started, I want you to know this is an EMT class, not a biology class and not a chemistry class. So we're not going to go into great detail on pathophysiology, but we will go over the basics. Topics. We're going to talk about the cell, the regulation of homeostasis, the cardiopulmonary system, shock, and pathophysiology of other systems. Intro. What is pathophysiology? It's the study on how disease process affects the function of the body. If we have a good understanding of this, we can recognize changes in patients or that the patient is going through during an injury or an illness, right? And understanding also helps you recognize the need the body in the most vulnerable state and how maybe we can treat these patients. The cell. The cell membrane protects and selectively allows water and other substances in and out of the cell. For example, sodium, potassium. It lets glucose in. It lets other electrolytes in. The mitochondria. We talked about this in the last chapter, I believe, or the chapter before, how it converts glucose and other nutrients and oxygen into this adenosine triphosphate, or ATP. ATP is the fuel for the cell. It needs it to function, right? Without it, it can't perform its specialized features or function. And then eventually, if it don't get enough energy, it'll start dying. Here's a diagram of a cell. We've all seen this from grade school biology all the way through chemistry in college. So we've all seen this picture before. It's a pretty basic diagram. The cell needs water, right? It needs a correct balance of water, inside and out. Too little, it'll dehydrate and die. Too much, the cellular function will be interrupted. The water also affects the level of electrolytes, which impacts the electrical function of the cell. For example, if your electrolytes are off balance, you may feel weakness, may not be able to move your muscles as well because the electrical function of that cell is affected. Glucose in the cell, it's the building block for energy. We've talked about this several times. You take glucose and oxygen and it turns into ATP through the mitochondria, and that's the energy for the cell. The insulin, the supply of insulin must match the body's glucose, right? We've talked about this a little bit before too, that the insulin is actually the key that helps the glucose be able to penetrate the cell membrane. So it's like the key to the gatekeeper, and it lets the glucose in. All right, oxygen in the cell. We're going to talk about two different types of metabolism. The aerobic metabolism is your normal metabolism. That's what we do with using oxygen. If our oxygen supply is enough to meet demands, we use aerobic metabolism, which means we use oxygen, glucose, convert to energy. The cell uses the energy, and the byproduct is carbon dioxide. Now, on the flip side, anaerobic metabolism is your cell's going to try to metabolize and use energy regardless if it's oxygen or not. So if it doesn't have the right amount of oxygen, it's still going to metabolize. But the problem is it's going to create a whole lot less energy and a lot more waste. So the body will become acidotic, especially lactic acid, impairing the body's function. And eventually, these waste products build up and starts killing cells. Cells start dying, then the organs die. Once the organ starts dying, the organ system fails, and eventually the organism or the human will die. Here is aerobic metabolism. It shows the oxygen and glucose entering the cell, CO2, or it being converted to ATP. Then its waste product is CO2 and water, the extra water it removes from the cell. This is a normal function. This is anaerobic. This is where the oxygen levels are too low for the cell to metabolize normally. So it's still going to metabolize, but the byproduct is going to be lactic acid, as you can see there. The vulnerability of cells, organs, and organ systems. Diseases can alter the permeability of a membrane, which means if they become less permeable, then they can't get glucose and other electrolytes and water in the cell. Or if they get too permeable, they'll lose all their water out of the cell. Ineffective cell membrane can allow substances into the cell that shouldn't be there. And these substances can interfere with the regulation of water, like your proteins, right, that move water back and forth. The regulation of hemostasis. Homeostasis is regulating the brain. This is the body's way to maintain a normal state. It wants to be in a neutral position, right? So it's regulating the brain, maintained through the nervous system, feedback and messages, and all the glands and stuff like that. And the key structures of the hypothalamus and the medulla oblongata, right? We've all heard the word medulla oblongata in the movie Waterboy, right? It's in the brainstem. It has a lot of regulation control. The fight or flight response. We're going to start talking about the nervous system. We're going to start talking about the parasympathetic nervous system, which is nicknamed the feed and breed function, right? Neurotransmitters regulate digestion and reproduction. So your heart rate's going to drop, blood pressure is going to drop. This is the state that we're normally in. We kind of live in this state. It's to chill and digest, right? Your digestive function works. Your heart rate's at the normal lower rate. Blood pressure is normal lower. On the flip side, the sympathetic nervous system is your fight and flight. This is like, for example, when you get startled or spooked, your sympathetic nervous system will kick in. Epinephrine and norepinephrine are released. These are both hormones that'll enhance the body's ability to protect itself. For example, it'll increase the heart rate, the blood pressure, your pupils will dilate, your bronchi and your lungs will dilate to get more oxygen in, and blood flow to the muscles will increase. And on the flip side, the digestive tract and your breathing system will kind of slow down or will be slowed or halted during this time. Okay, the cardiopulmonary system. Respiratory and cardiovascular system has to work together, right? If one's off, and then the whole system's not working. So the point of it is it brings oxygen to the body, distributes it to the cells, and remove waste. That's the whole function of the cardiopulmonary system. Any breakdown can result in system failure and eventually into a form of shock, which we'll talk about later. This picture we've seen a few times in the book, throughout the book. It's the bronchial tree. It shows how the main stem bronchi will coming off of the trachea, and we go to the carina, which is the split in the bronchi. We got the main stem bronchi, and then they start getting smaller and smaller and branching out, and they eventually become bronchioli, which is the smallest version that attach to the alveoli. And here's a picture of the alveoli. And as you can see on the right-hand side, it's got a good picture of the capillaries that wrap the alveoli and the elastin fiber, which allows this alveoli to expand without rupturing to a certain point. The airway. We must have an open, or what we call a patent airway in our system, in our world, for the system to function. If we don't have an airway, we don't have a patient. You're going to hear that said over and over throughout your career. So we got to have a good patent or open airway. The upper airway obstructions are common. This can be caused by foreign body, infection, and trauma. Going back to foreign body, that can be an object like food, or it can be like blood or mucus or vomit. The lungs are part of the lower airway. We'll go into more detail next chapter on this, right? We're going to start talking about tidal volume. This is the amount of air moved in and out during each breath, or the volume. It's measured in milliliters. And we can calculate the minute volume by taking this tidal volume times the respiratory rate. And this means the minute volume is the amount of air moved in and out of the lungs in 1 minute. So, for example, if Mr. Joe Blow is breathing in a total tidal volume of 500 ml and he's breathing 12 times a minute, we've got a minute volume of 6,000 ml. Any change in this tidal volume or the respiratory rate can reduce the minute volume. Makes sense, right? If I breathe in less, but the same rate, I'm going to be taking in a less minute volume. And vice versa. If I breathe in more, I'm going to have a higher minute volume. Respiratory dysfunction occurs anytime something interferes with your minute volume. This is what we call respiratory dysfunction. So if something is interfering with our normal minute volume, then we're in a respiratory dysfunction state. And we'll talk about respiratory dysfunction. Disruption of the respiratory control. Your respiratory is controlled by the medulla oblongata. Any event impacting function of this medulla oblongata can affect the minute volume, right? So it can get infection. Drugs can cause us, toxins, trauma. Let's look at these separately. Infections, like one of the big ones is meningitis or encephalitis. Oh, sorry, can't say that. But meningitis is just one of the meningeal fibers, which wraps around the brain and spinal cord for protection. And the other one is going to the brain. So this can cause issues on the medulla oblongata. Drugs, of course, can function like, for example, narcotics will slow this and it'll drop the respiratory rate. Of course, toxin and trauma all can cause impede the function of the medulla oblongata. Disruption of pressure. For example, if you get a hole in the chest wall, like a stab wound or a gunshot wound, this will reduce the pressure and mess with your negative positive pressure. So your actual volume will go down because you can't breathe. Air or blood can accumulate in the pleural space. This pleural space is the space between the lungs and the chest cavity or chest wall, right? You got to have some space there, or your lungs will rub on your chest wall and you'll create trauma. Trauma or medical problems can compromise the ability of the alveoli to exchange gases. So if they can't exchange gases, the less oxygen gets in, the less carbon dioxide gets out. So you'll have lower oxygen level or hypoxia and higher carbon dioxide level, which is hypercapnia. Hypercapnia. Respiratory compromise. Your body's going to attempt to compromise, right? For this gas exchange deficiency. You got chemoreceptors in your brain will detect that oxygen level and carbon dioxide levels are off. So what it's going to do, you're going to breathe more or increase your tidal volume. You're going to breathe deeper. If I need more oxygen, first thing my brain's going to do is say, hey, I need a little more oxygen. So I'm going to bump up the respiratory rate. And maybe even I may take deeper breaths. Okay. Moving on to the blood. 4 parts. Plasma. That makes up the majority of the blood. That's the liquid. The red blood cells. They carry hemoglobin, which the oxygen bind to the hemoglobin. The white blood cells are the leukocytes. They're the soldiers, right? The troops. They fight infection. And the platelets will form the clots. They plug the holes. Plasma ionic pressure. This is the protein in the plasma. Attract water away from or around out of the cell and pulls it into the bloodstream. That's how we keep that water balance, is through proteins in our plasma. Hydrostatic pressure. It's when the water pushes back out of the blood vessel towards the cells, right? Problems with this proteins can cause an imbalance. So, for example, if we have liver issues like hepatitis or liver trauma, and then our liver is not able to create these proteins, we could start to see a water imbalance. Let's talk about some deficiencies in the blood. Without enough blood, oxygen, carbon dioxide cannot be properly moved in and out, correct? Because they're the blood's the transport unit for both of these. What could cause you to not have enough blood? Bleeding, of course, dehydration can, anemia, and liver failure. What anemia is? Low blood iron. You need blood iron to create new red blood cells. So if you don't have enough red blood cells, you won't be able to carry enough oxygen. And we talked about the liver failure and the proteins because water imbalance or volume issues, right? Here's a picture of the network of arteries, veins, and capillaries. This is how it all works. The arteries start shrinking down and get into arterioli, go over to the capillaries. From there, the exchange happens in the cell. And through diffusion, the carbon dioxide comes over to the vein or the venules into the veins and back to the heart and lungs. The oxygen blood from the lungs via heart to the capillaries. What the blood vessels do. We talked about they're the carriers. The gas exchange will happen between the cell and capillaries. They have really thin-walled membrane, and through the process of diffusion, where we go from a higher concentration to a lower. So in the cell is a lower concentration of oxygen, but a higher concentration of CO2. So they'll diffuse across the membrane, and they'll equalize or level out. Returning blood goes to the lungs via the heart after gas exchange, and then the same process with the capillaries and alveoli. Again, diffusion works. The CO2 is offloaded, and then the oxygen is onloaded. We need adequate pressure to make this work, right? So we have to have blood pressure to keep pushing this all through the system. How do we control our blood pressure? How does your body control blood pressure? It changes the diameter of blood vessels, so it will constrict or make smaller, or it'll dilate and make bigger. So if our pressure is too low, it's going to constrict using a smooth muscle layer in your vessels, and they'll constrict and they'll make that vessel smaller, which will in turn increase the pressure. So, for example, if we take your house plumbing, it comes off of a 6-inch main line or an 8-inch, 12-inch, whatever line. Okay, we got this water going through this line, and then you're hooked into off of your meter. It comes off of that 6-inch, and it converts it down to 1.5 inches. And by the time it gets to the sink, you may have a 1/2-inch line. So as we constrict this flow to smaller vessels, it builds up pressure in it. That's how you get pressure at your faucet. Stretch receptors will monitor your pressure. That's how it works. And if it needs more pressure, it's going to constrict. Less pressure, it's going to open up. And we talked about how it increase or decrease. Some things can cause you to lose tone, which is the vessels loses the ability to constrict or dilate. That's what the loss of tone means. The pressure can drop. Causes of this loss of tone can be trauma, of course, infection, and allergic reaction. Here's a nice picture of a dilated blood vessel. See, on the left is a normal vessel, and on the right is a dilated. See how pressure can drop? Because the volume stays the same. The amount of space inside the vessel gets bigger, so the pressure will in turn drop. You can have excessive permeability in your vessels, which will cause leaking from your capillaries through their walls. This is caused by severe infection like sepsis, high altitude, and certain diseases can cause this. Here's a nice picture of an increased permeability. Allows too much fluid to escape through the capillary walls. And it goes into the third spacing, or we'll talk about that later, instead of staying in a vessel or cell, and it calls like edema. Hypertension is high blood pressure, right? If we break down the word hyper, mean high, tension, pressure, high blood pressure. We're talking about the systematic vascular resistance. This is the pressure inside the vessel. Various conditions can lead to abnormal constriction of vessel, leading to unhealthy high blood pressures. There are some abnormal or conditions like, for example, smoking can cause this. Chronic smokers, other diseases can cause this. And when this happens, it's a major risk factor in stroke and heart disease. We can lose the loss of regulation. Chemical messengers tell the blood when vessels to dilate and to constrict. If for some reason the signal gets blocked, like trauma or infection, the problems can arise. Maybe your pressure is dropping and it doesn't get the signal to constrict, so it just stays the same, and your blood pressure will keep dropping. Lack of sympathetic response can cause shock. The heart, it's the pump, right? And the average stroke volume, we're going to talk about stroke volume, that's your output. How many milliliters of blood leaves the heart per contraction is about 70 ml on the average adult. The stroke volume is based on preload. That's the amount of blood returned to the heart, right? So we got to have a certain amount or your preload. Contractibility is how hard it squeezes. If it squeezes super hard, you may be squeezing out 100 ml. If it squeezes too soft, you may only get like 50 ml. Afterload is the pressure the heart has to pump against to force blood out of the system. There's going to be pressure built up from the blood that's already in the system. So the pump has to pump a little harder, and this is that afterload pressure. Let's talk about cardiac output. It's stroke volume times the heart rate will give your cardiac output. So if the rate slows or decreases stroke volume, it'll reduce the output. And same way, if we've got a very fast heart rate, that'll reduce it because it won't give the chambers time to fill up with blood to squeeze it out. So it'll reduce your output. Pediatric compromise. Infants and young children, right? They rely on heart rate to compromise. So if we start to get poor perfusion or hypoperfusion, the first thing in a child is the heart rate will go up. But there's some issues. They have a lack of contractile muscles, so the heart's not fully developed, so it may not be as strong. They can't regulate this contraction. And fast heart rate will indicate compromise or compensation, that they may be in a form of compensating shock. We'll talk about here in a little bit. Mechanical problems, they're physical problem, trauma, squeezing force, cell death, like heart attack, will cause mechanical issues, which means the actual mechanical function of the heart. Then we can have electrical problems, damage to the heart's electrical system for some reason, cause unorganized rhythms and rate if the system becomes damaged. All right, let's kind of put this all together. The entire cardiopulmonary system must work together to maintain life, right? If it doesn't work together, then the system will fail. There must be a balance between the ventilation, which talked about ventilation is moving air in and out, and perfusion. That's the oxygen reaching the cells and being perfused to the cell. And for the system to work properly, we call this the VQ match. So we have to have a good VQ match. VQ ratios can be disrupted by any challenge to the cardiopulmonary system. For any reason the system doesn't work, or one part of the system doesn't work, this VQ ratio will become mixed matched. So, for example, I'm moving enough air, but I'm not getting the blood pumped around to where it needs to be, then I'm not perfusing, so the Q rate will go down. Let's talk about shock for a little while. Perfusion. This is the delivery of oxygen nutrients to the cell and taking away the waste. That's what perfusion is. It's the definition. Now, hypoperfusion means it's not getting this. This isn't getting done. Either it's not getting enough oxygen or it's not getting a waste product removed. And if we don't fix this for some reason or figure out what's causing this, the patient can die. That can be the result. It's death. 4 categories of shock. We got hypervolemic, which is low blood volume, either through blood loss or dehydration. There's a disruptive shock, which is low blood vessel tone, which is like septic shock and anaphylaxis or allergic reaction. Cardiogenic shock is some reason why the heart failed. A lot of times, either trauma or disease process like an MI or heart attack. Obstructive, the blood can't flow for some reason. Like, for example, the heart has trauma and the sac around the heart starts filling up with blood. It's a cardiac tamponade. After it fills up with enough blood, there won't be any room for the heart to refill. Or like a pulmonary embolism can cause obstruction. We want to recognize compensating shock, right? There are three levels of shock, and we're going to go into that a little bit. Now, there is a whole chapter devoted to shock, so we're not going to go into great detail on this chapter. When problems arise, the body attempts to compensate. We talked about that homeostasis, right? It wants to stay in that neutral position, so it's going to compensate. So signs of compensating shock: it's slight mental status changes, increased heart rate, increased respiratory rate, delayed cap refill time, pale, cool, and clammy skin, and sweaty. So let's talk about the cap refill time and the pale, cool, clammy skin. What's going to happen is for your body to compensate, it's going to shunt off your periphery or your arms and legs, and it's going to direct that flow of blood back toward the vital organs, the heart, the lungs, the brain, and the kidneys. So if your periphery is not getting perfused or enough blood, you're going to have a delay in this cap refill time. And then pale, cool skin because it's not getting the blood. Decompensating shock occurs when the compensating measures fail, right? Your body can no longer compensate for some reason. It's characterized by decreased blood pressure and altered mental status because their brain's not getting perfused. So the first thing it's going to do is you're going to become altered. But the big sign that you're moving from a compensating state to a decompensating shock is the blood pressure is going to start dropping. Irreversible shock. It occurs when inadequately perfused organs start to die. Patient death commonly follows. One of the biggest signs to know that we're moving into this state is our heart rate will start dropping. Our blood pressure's already dropped. Now our heart rate's dropping. Pathophys of other systems. Fluid balance. Body is 60% water, right? Intercellular, which means inside the cell. We got 70% of this, 60%. Intervascular, which is in your vessels, is 5%. And interstitial, that is that third spacing I was talking about. There's 25%. Here's a nice little diagram. It's in your book. By the way, while I have a moment to talk about it, if you're not in my class, I'm going to stress this to everybody that watches this. You definitely want to read your chapters. I can't stress that enough. Reading your chapters will lead to a success rate of passing a class and the nationals. So make sure you read your chapters. Fluid balance. Brain and kidneys regulate this, right? To eliminate too much fluid. So sensors in your brain says, hey, we got too much fluid. Where your kidneys in high gear, they're going to create urine, and it's going to be excreted from the body. Blood plasma proteins pull fluid into the bloodstream, right? So if we have something interrupting with these plasmas, for example, or proteins, for example, your liver failure or liver function isn't up to what it should be, this could be an issue. Cell membrane and capillary permeability regulate flow in and out. This is how it moves in and out. It's through this permeability of the cell. So anytime we have anything that will affect this permeability, it will change it or cause a shift in our fluid balance. Fluid loss is dehydration, decrease in total volume. We can get this by someone sick for a few days with extreme vomiting and diarrhea. They could become dehydrated. Being out in hot weather, you're not replacing fluid. You sweat all that out, you can become dehydrated. Poor fluid distribution, water not getting where it needs to go, right? And edema, swelling associated with movement of water. We talked about earlier with this fluid or water leaking out of either the cell or the capillaries into the third spacing, causing edema. The nervous system, the brain and spinal cord, well protected by bone and muscle, right? You got your skull and your spinal column. You also have several protective layers called the meninges, or the meninge fibers. And you have a layer of fluid that's designed as a shock absorber called the cerebral spinal fluid. Even though you have all this protection, it still can be subject to damage through trauma and diseases. Types of trauma that can cause motor vehicle accidents, falls, diving accidents, blunt force trauma. You get smacked in the head with a ball bat or a club. A penetrating wound like gunshots or knives. These can all be part of the trauma. Medical dysfunctions like stroke, infections, meningitis, encephalitis. What I was talking about earlier, the word I couldn't say, encephalitis, swelling of the brain. Certain diseases like Lou Gehrig's disease, MS, affect your neurons and blocks the messaging. And low blood sugar or hypoglycemia. Let's break that word down. Hypo meaning low, glycemia means blood sugar. So you have a low blood sugar. This can affect your nervous system. The endocrine system, we have glands that secrete hormones, all kinds of glands. Hormones send chemical messages that controls the body functions. Major organ systems of this endocrine system, the brain, kidneys, pancreas, pituitary, thyroid glands, and adrenal glands. Let's talk about dysfunction of the endocrine system. Organs or gland problems present at birth or result in illness. Some of these, you're born with these problems. Some of them, you develop an illness. You can have too many hormones. For example, Graves' disease. It's too much of the thyroid hormone. These patients will have problems regulating their heart rate and their body temperature. Or you can have the flip side, not enough hormones, like type 1 diabetes, where you don't have enough insulin. You produce very little or no insulin. So you become a diabetic, type 1. Adrenal insufficiency, affected steroids and hormones like cortisol and ALD. Medications can suppress the immune system, can also suppress the adrenal function. What kind of medications, you ask, would suppress the immune system, and why would we want to do that? One of the big ones that come to mind is like transplant patients. They're going to suppress the immune system. Or if they got an autoimmune disease, they may suppress their immune system. Can result in patients stop taking prescribed. If a patient would suddenly stop taking their prescribed steroids, this can affect the adrenal function. So it's always a good idea to talk to your doctor before you just suddenly stop taking any medication. The digestive system allows food, water, and other nutrients into the body, right? Major organs are the esophagus, stomach, and intestines. They didn't mention mouth here, but that's a big part of the system as well. Digestive dysfunction impacts dehydration or hydration levels, nutrients transfers. We talked about earlier, right? If you have a lot of vomiting, diarrhea, you can get dehydrated. Gastrointestinal bleeding can be slow, like a chronic bleed, or it can be massive or an acute, like a rectal bleed or vomiting of blood. Vomiting, diarrhea, most common disorders. A variety of causes, right? A lot of things can cause vomiting, diarrhea. Anything from like the flu to anything. I mean, literally just about anything can cause vomiting, diarrhea. May result in malnutrition, dehydration if we go several days without rehydrating or getting our nutrients in. this can be a problem. The immune system. The whole job of the immune system is fight infection. It will respond to invaders, and it'll mark them and destroy them. Hypersensitivity or allergic reaction. This is when an allergic reaction to certain foods, drugs, and other substances. For example, peanuts, soy. These are all big food allergies. Drugs, we see like this can be prescription drugs and erotic drugs, but we see it a lot in our world in prescription drugs like penicillin, sulfa, morphine. These are all drugs that have high allergies and other substances. For example, um, it's whatever. It results in an exaggerated immune response. So your immune system goes into hyperactive drive, and it'll attack something that it thinks is an invader, and it chemically affects way more than just that invader. It affects your respiratory, your heart rate, all other systems. It'll produce edema, swelling, especially in the airway, result in rapid drop in blood pressure because it's a disruptive shock, remember? And it can be very life-threatening if left untreated. Let's review a little bit. Pathophysiology allows us to understand how negative forces impacts the normal function of the body. Remember, it's a study on how what affects the body function. Pathophysiology helps us understand how common disorders can cause changes in the body. Understand how the body compensates for insult, sheds light on the signs and symptoms we may see during assessment. Remember, compensating shock, the heart rate's going to go up, the respiratory rate's going to go up. They're going to become pale, cool, clammy, diaphoretic, or sweating, and they'll have an extended gap refill time. Understanding what compensating looks like will help us rapidly identify potential life-threatening problems, like hypovolemic shock. Even though we can't see bleeding, they still may be. Or allergic reactions turn into anaphylactic shock. Cellular metabolism requires constant supply of oxygen and glucose. If something happens to either one, it's going to disrupt the normal metabolism. Go from aerobic to anaerobic. Remember the differences. Anaerobic is our normal metabolism where we take oxygen and glucose, turn it into ATP. The cell burns it and produces CO2 or carbon dioxide. The anaerobic metabolism is when the cell doesn't have enough or sufficient amounts of oxygen, so it's still going to convert glucose into ATP, but it's going to result in less energy and a lot more waste. And if left unchecked, it'll turn into lactic acid, which will change the pH levels in the body, and the body doesn't do very well with that. The cardiopulmonary system combines the function of both the respiratory and the cardiovascular system to provide oxygen and nutrients at the cellular level, and they have to work together for normal function. Shock occurs when this cardiopulmonary system fails, or cells become hypoperfused. The body is composed primarily of water, and this fluid is distributed throughout the body, and is controlled by the brain and kidneys. Remember that.